There's also simple squamous, but that was making up a capillary. But anyway, all right. What tissue is this? Okay, now how are you going to know that? It's a low magnification, but it looks like, well, this looks like columnar cells up here. There's a lot of empty space with no nucleus. And then it looks like there's a few rows of nuclei underneath. And it has lots of mucus, so you know there are goblet cells in here. Those are the goblets there. Those. And cilia, you can almost see. So you look at all the clues, put them together, and you should come up with pseudostratified ciliated columna. And what is this? Hyaline cartilage. Okay, place where the two of them would occur together, a good place would be trachea. Or there's another place. How about this cartilage could be part of the septum of your nose inside, or the outside of your nose. And this could be the lining of your nasal cavity too. But we'll go with trachea, it's easier. What's that? A tooth. What's the red stuff? And the blue-white stuff. Dentin. Don't put the E on there like dentine gum or something. Okay, and then this is the pulp cavity with what should be in there. Nerves and blood vessels, yeah. And all this stuff is called gingiva. Gingivitis. What is this thing? A duct of a gland, sure. So these are acinar cells, soft pillow things, some kind of gland. This tissue, stratified squamous, inside or outside?
Inside.
How do you know?
Dead.
Nothing dead out here. These nuclei go right to the surface. Nice moist environment for it. What about all these little bumpity bumps over here? What kind of tissue is that? Or not tissue, but what would be the structure? A gland. Remember we were talking about bumpity bumps? There's a better picture of bumpity bumps. See, this is all gland in here. Like little clouds, bumpy clouds or something from a low magnification. When you get up close, then you see the acinar cells and their little clusters, but just from a distance, it looks like little bumpy cloud. So that's a gland. What if you had little bubbles going up to a surface? What's that? It's the duct of another gland, isn't it? Some kind of gland. It's got tubular gland. Oh, the mystery meat. Let's look at that for a second. Or two. And the question will be, what is that red, or what is the red stain trying to show? It's not trying, it's doing a good job. But okay. Ooh. Oh, I'm so sick of kidney. Okay, now what was this thing up here? What? Stretched out, transitional, wasn't it? Transitional epithelium, doesn't look like anything else, so it's got to be transitional. What's this stuff? Areolar connective tissue, right. And then here's the relaxed transition. Several layers thicker than the stretched out version. lining the urinary bladder or ureter would work. Not, don't use urethra because that's too, there's not much of it in there, so for urinary bladder, ureter. Where are we again? Seminiferous tubule in what organ? The testis. And blah blah blah. All right. And then what is this area? What are all these? Sperm with tails. So we know we're not in the seminiferous tubules because there they were just getting the heads made and got the tails. So now they've moved into the epididymis and the sperm there with all the tails ready to go. Okay. And what do we call these itty bitty cells down here?
Primordial follicles.
Yeah, primordial, not primary follicles. And then they start maturing. Where are we anyway? Ovary, okay. And they become the Graafian follicle, great big one, and the oocyte now is all mature, ready for ovulation. Okay. What's the tissue? This time it's the true stratified, not pseudo-stratified, columnar. It is not ciliated. Those are microvilli, you see, not cilia. And there aren't any goblet cells. There are definitely some rows of cells under these columnar cells, so it's true stratified columnar. Okay. Where do we find it? The most common place. Male urethra, yeah. Oh, not again. Merry Christmas. Ta-da! Get out of there. Alright, what is this structure stringing across here from the follicle up to the epidermis? Erector pili muscle. Remember, 2 R's and 1 L. Don't get carried away. And what does it do? Raises the hair. We'll talk more about them in our chapter 5 tomorrow. And look at little moon. Okay, and here we have little bubbles. So that is an eccrine sweat gland. Yeah, and here's another one. Remember the drawing, it's a tubular gland. It's all coiled up, so that's why all of these, and then the long tube goes up to the top. What do we call its opening up here? Pore. Yeah. Oh, that's enough there. Oh, these little guys attached to the, this is the follicle, right? Who are these things attached to the follicle? These sebaceous glands, yeah. They're sebaceous, they're not sudoriferous. All the other skin glands are sudoriferous, but the sebaceous are not. So, the eccrine sweat gland, that's a sudoriferous gland. Yeah, you have to check out that categorization they got. Oh, so simple. Simple what? Cuboidal. Anybody remember what these are? The potatoes? Smooth muscle. Smooth muscle cells. I don't usually use that on the test. I just like to show you the way it keeps up. Alright, now what tissue is that? It's not smooth between the cells. It's got a lot of fibers in there. The cells are closely packed together, so it's elastic cartilage. Okay. Doesn't look like the corn nuts in that other picture.